Hi, I'm Dr. Neil Amin with the Advanced Relief Institute. If you're watching this, it's likely because you're dealing with pain, an injury, or something that's been slowing you down, whether it's training, competition, or just everyday movement. First, I want you to know you're in the right place. Our goal is simple. It's to help you understand your options and see if there's a path to support your recovery without having to succumb to surgery. What we see a lot, especially with active individuals, is joint pain that just keeps coming back, tendon and ligament injuries that never fully heal, inflammation that limits your performance and mobility. And most people are told the same thing: rest it, physical therapy, injections, medications, and even surgery. So, what we're focused on instead here is how can we support your body's natural ability to recover? That's where regenerative medicine comes in. Let's start out with the three different products that we use. The first one is exosomes. I'm sure you've heard of exosomes, and they're incredible. You can think of exosomes as tiny messenger particles, and these particles play a role in helping your body communicate, especially when it's trying to heal itself. They carry signals like proteins and growth factors that help coordinate your body's response to an injury. When you use treatments like exosomes, they're applied to targeted areas that support your body's natural ability to repair itself. It helps manage inflammation. It helps support recovery of joints, muscles, and soft tissue. For many athletes, this becomes a way to support recovery while staying active. So you don't have to stop your training while at the same time you're healing. That's incredible. Next is Wharton's jelly. This is a biological material that's really rich in supportive components that your body uses during the healing process. Think of it creating the right environment for recovery for your body. It contains some amazing things: structural support elements like growth factors, components that support tissue health. In many cases, it's used with other therapies like stem cells and exosomes to enhance the overall effect and support longer term recovery. Now, let's talk about something we all know about: stem cells. And there are many different kinds of stem cells, but we use mesenchymal stem cells. Mesenchymal stem cells are special because they're the ones that can repair injuries and create connective tissue like collagen and cartilage. And it really supports the body's ability to repair itself. All these modalities of regenerative medicine, they may help support tissue health, assist in managing inflammation, and also it plays a role in injuries that are needing repairs. So for active people like you, these therapies are used as part of a physician-guided plan to support recovery in areas like joints, tendons, ligaments, and particularly even the spine with the neck and low back areas. What's important is to understand that these therapies are not a one-size-fits-all. Some patients may benefit from a localized approach where you target a specific joint or injury. And this is important because you're able to target through image-guided procedures using an ultrasound machine and using an X-ray machine to create a repair for the injured site. Another approach is doing a systemic approach, and this is used by doing IV infusions. And these are special because you're able to administer these products like exosomes and stem cells and create a repair and restoration that's from within the body. It's doing it at a cellular level. And my advice, and I think the best approach, is doing a combination approach, doing a targeted treatment combined with an IV infusion, because this is the best way to optimize your body's ability to repair itself. This is what's going to lead to better training sessions, better fights, and then having more recovery that's so much better than without using regenerative medicine. So that's where everything starts with an evaluation. And actually, this evaluation is virtual, and it helps determine which approach makes the most sense for you. Based on your evaluation, we can typically build treatment plans And they're around a few approaches. Number one is to do the localized approach, which is targeting a specific area, like a muscle, joint, ligament, tendon. You can do a systemic approach where we try to treat the whole body globally and to create a repair at a cellular level. And these are designed to support recovery where your body needs it the most. Systemic recovery, full body support. This approach is used to support your body's ability to broadly heal, especially if you're dealing with multiple areas of discomfort and injuries, and you're dealing with chronic inflammation that's riddling your whole body. And we all know that athletes like you are victims of this inflammation and injuries. So having an ability to treat it globally is incredibly important. This is designed to support your body's recovery environment as a whole. It optimizes your body to be able to repair itself. And number three, the combination approach, which I find to be the most comprehensive approach. In some cases, we find that both doing a targeted treatment and doing something for systemic support, it's often the most comprehensive way of treating a patient that's active like you. Treatment plans, they vary depending on your needs. And we'll walk you through that whole process and we'll let you know what options during your consultation are the best for you so that you can make an educated and informed decision. The next step is simple. We'll review your conditions, we'll understand your goals, and we'll determine if you're a good candidate for these treatments. And that'll be done through a virtual consultation that we can do within a couple of days. We'll take the time to walk you through everything and to build a plan that fits you. We look forward to meeting you.